Today, we're going to talk about a very important subject during COVID-19, and that's about mental health. And really, we talk so much about the physical ravages of COVID-19, but the mental health of all of us due to social isolation, it certainly was an epidemic globally prior to COVID-19. But in our conversation today with Chris Ide, the Vice President of Corporate and Community Partnerships at CAMH Foundation in Canada, one of the things that I thought was so profound was Chris's tips for both people, the public, who can go to their website and learn all sorts of tips and tools regarding managing stress and anxiety. But he also had some wonderful insights for business leaders. In a LinkedIn comment, he said, "Attention business leaders, lean into your role as normalizer in chief. Encourage your team to lean in or out in whatever way feels best from them and their families. Tell them whatever works for them works for you. Remind them they're doing great, especially when they feel that they're not. It is your job to support their psychological health and safety. Let's flatten the mental illness curve."
My name is Chris Ide. I live with my family in Toronto, Ontario, Canada, and I am the Vice President, Corporate and Community Partnerships at the Centre for Addiction and Mental Health Foundation, which is Canada's largest mental health teaching hospital and the world's leading brain science research center.
We hear so much about the physical health during these really trying times, but we also have the greatest stresses on mental health. So why don't you share with our listeners a bit about your overall services, and then, really drill down into what you're doing during the pandemic?
Sure, I'd be happy to do so. And I think your insight that mental health is a priority for many people, just like their physical health is an apt insight. And I think we as an organization know that in this unprecedented time of uncertainty, it has never been more clear that mental health is health. So we are Canada's largest mental health teaching hospital. CAMH is the world's leading brain science research center. And before this pandemic hit, we would, on average, every year care for 40,000 patients. These are the sickest of the sick who get referred into our hospital to treat their acute mental illness. In addition to clinical services, we also, like I mentioned, are the world's leading brain science research center. So we produce a lot of great research, which really helps inform clinical care. So we're really quick at moving from bench to bedside, as we would say. Also, with respect to education, we train 25% of all Canadian psychiatrists and 50% of all Ontario psychiatrists, so they come and do their residency here at CAMH. And then CAMH as an organization is actually very unique in that we also have this advocacy mandate that we operate under. So we advocate for new public policy initiatives at the federal, provincial, and municipal levels across Canada. So, really seen as the preeminent mental health resource and voice pre-pandemic. During this pandemic, it's been, really fascinating to see our organization and its leadership pivot and move rapidly at the speed of the pandemic to address the growing concerns and issues that people are facing. So, the first part of our response has been and continues to be the continuity of service for our patients, making sure that the health and safety of our patients and their families and our workers, our clinicians and researchers are protected during this time is of greatest priority to the hospital and to our organization. It's been fascinating to see us adopt more telemental health practices. So being able to deliver our mental health services where possible virtually. I think in the first few weeks of this pandemic, we had gone from, we're an organization of about 3,500 people, and we had gone from just over 30 clinicians delivering telemental health services to, at the end of last week, over 435 clinicians delivering telemental health services. And during that time, they've been able to scale their telemental health services to patients tenfold. So we've seen a record number of patients being able to receive mental health care virtually, which is really inspiring. That has established our sort of leadership platform in this space. A lot of other hospitals and community healthcare providers have turned to CAMH to ask us how we scaled and built out our telemental health capacity so quickly. And so right now, the hospital is also focused on training other healthcare providers.
How did you scale so quickly at the speed of a pandemic?
We have really incredible people and clinicians who are the best in class when it comes to providing these services. So I think our capacity, or the hospital's capacity, under that education pillar, we're training physicians all year round.
Mm-hmm.
It's been, they've leaned on those skills and those assets to be able to deliver these services and these training abilities to other hospitals and healthcare providers.
So you're just continuing, what you've known for so long.
Yeah, that's right.
So are you finding that first you said you wanted to continue continuity of service for your current patients, but you must be getting just an influx of new patients, especially with your telemedicine. So are you finding, are there similarities in terms of the concerns of people at this point, or are they just very, very broad?
In addition to providing continuity of service for our patients, CAMH is also focused on making sure that the public, that the business community, and that frontline healthcare providers have the tools and resources to cope during this time and to build their own resiliency. It's been fascinating to hear people describe the COVID-19 pandemic and speak specifically in terms of, the physiological needs of people, the physical health of people. What we're also considering is the echo mental illness curve that may follow this.
Mm-hmm.
I'm sure you're feeling this like I am.
Yeah.
Where we're, physical distancing is really helping us reduce the spread of COVID-19, but that isolation is taking away one of the most important tools that we have for our mental health management, which is social interaction. And I think in a lot of cases, this isolation is leading to loneliness, and loneliness can lead to a host of other mental health issues like anxiety, burnout, depression, addiction. And then, compounding all of this are other factors that are increasing the risks to mental illness, like financial instability, loss of employment, and worries over the health of loved ones. And so we as an organization are also providing supports and resources to those three populations. So the public broadly, the business community, and frontline healthcare workers. And we're doing that in a number of key ways, and not least of which is on CAMH's COVID-19 and mental health resource hub on camh.ca.
Can you be specific about, what are the most important things that the public needs right now? And then let's talk about what's the most important thing that business needs right now.
So I think, from a public perspective, it's having access to research-informed mental health solutions. And, I would bold and italicize and underline the words research-informed. So on CAMH's COVID-19 Mental Health Hub, we've included some really valuable tools, including, for example, a self-assessment survey to gauge your own stress levels. We just launched an app version of this a few days ago called Managing Your Stress and Anxiety. People can search for that on the App Store or on the Google Play Store. And in that app, the tools and resources that are included in there are really in response to, I think, what we're seeing. So there's online resource, including tips, coping strategies, and resources to just generally manage your mental health during the pandemic. There's information on how to support loved ones during this challenging time, people who may be dealing with isolation, or how to talk to your children about COVID-19. As a dad of young boys, twin boys, I can tell you that resource specifically has been immensely helpful. And like I mentioned, there's some really great self-assessment tools for stress and anxiety as well, to help gauge where you are on the spectrum of mental health, and some good resources to point you in the right direction on where you need to seek help.
Again, what is the name of that app so our listeners can assess it?
It's called Managing Your Stress and Anxiety by CAMH.
Okay. And then can you just skip to what are in your mind a few of the tips that just a general person that maybe they're with their family, their kids are going stir crazy, maybe they still have their job, but it's obviously they're remote. What are some tips that you might have that you can recall from that website? Because I'm sure it's like, not the website, but the app. I'm sure they're quite extensive.
Yeah, there's a lot of good research informed stuff on the website. So, some of the things that I've found really helpful in terms of managing my own mental health, I've really struggled to separate my responsibilities as a parent and to maintain a regular schedule. So, setting up, for example, just before this call, we had a team meeting that was by phone, and where possible, we asked everybody to participate in that meeting while taking a walk outside. So, making sure that we get outside, get some fresh air, get some vitamin D, and to maintain a schedule as best as possible is really important. I think, switching gears into, my role as a leader and how do I support my team and their psychological health and well-being during this time, I think it's really important. And what I've described to my team members is to make sure that they maintain the relationships with their colleagues. It's critical to work performance and emotional and mental wellness. I think it's important that we care about people beyond work. So, when they can, just to check in on people on how they're doing, not just professionally, but also personally and So go on a virtual coffee date as you would at the office. When you ask somebody how they are, in everyday life, that may have just been an opening line. Pause and reflect on how they're responding to how they're doing. I think it's important for us to also model and expect honesty. So, again, picking up on that, when we often ask how you are, this is typically a pleasantry. Right now, these days, it's a crucial question, and to ask it and also answer it authentically. Even people who aren't alone will feel at times like there is a heavy emotional burden on them. And I think it's important that we recognize that everybody is struggling with their mental health through this pandemic, whether they're at home with family or alone, or with other loved ones. And at a time when there's just so much information floating around, it's just so important to go to credible, legitimate resources. So making sure that go to CAMH.ca, check out the CAMH.ca COVID-19 mental health resource hub, and find the tools that are most helpful to you.
That's really some wonderful tips. Take a walk, get some vitamin D. Probably a little cooler where you are than where I am. Maintain relationships with colleagues. I love your idea of just a virtual coffee, which is just listen and, model and expect honesty. And it's not just, hey, everything's fine, but hey, it's really, how are you doing? So I think those are really, really good tips. What about for the business community?
I think that's a great question. And, I just got off a call with my leadership team. We're, in some cases, have seen this curve apex, and you're hearing our government officials talking about, quote unquote, reopening the economy. And, I think that has the potential to create some feelings of anxiousness with people. What does that mean for me, and what does that mean for my return to work? Does my leadership team at work have a plan to reopen the office? And if so, do they have a plan to make sure that we're practicing the current physical distancing guidelines when we do reopen. Right before this pandemic started, CAMH launched a really powerful workplace mental health playbook for business leaders. It was a first of its kind, user-friendly playbook that provided a path to more effective solutions and better outcomes for businesses and employees.
Wonderful.
It was, we came forward with 5 research-informed recommendations, and these research-informed recommendations were based on the largest systematic review of research in the entire world when it came to effective workplace mental health solutions. And I went back to reflect on the 5 recommendations that we made when we launched this playbook on January 23rd. And even in these unprecedented times, these really powerful evidence-based recommendations can be adapted and used to create psychologically safe workplaces where every employee can reach their full potential. So I would encourage everybody as well to download this free resource. It's on camh.ca/workplace mental health, and you can get the playbook there. And it's really, really important that that organizations continue to invest in creating a long-term workplace mental health strategy.
Excellent. That's really an important resource for our listeners, and so we'll make sure that we put that in a show note. Certainly, both of your resources to the public. In terms of, and I love when you talk about research-informed recommendations, because there's so much content out there, but the fact that this is research-informed really makes them the most credible. I would love to, as we're closing, we always like to have our guests give insights and tips to other organizations. Now, yours, I think beyond mental health, you scaled really quickly. And you scaled dramatically. So maybe there's a tip on scaling. Maybe I'll let you do your own tips, but I'm sure you could do 100 insights, but let's just go for like 3 or 4.
Sure. I'd be happy to provide them. I think the first thing that really comes to mind for organizations, so yes, adopt those 5 research-informed workplace mental health recommendations. They include creating a long-term strategy, workplace mental health strategy for your organization, mandatory mental health leadership training, prioritizing and optimizing your return to work process, making sure that you're investing in workplace mental health solutions that are appropriate for the demographic of employee that works at your company, and tracking your progress. Like every business project or strategy, key performance indicators are critically important. But I would say above all of that, and maybe what just persists through all of those recommendations, are the role of leaders in being normalizers in chief. We're all feeling stress and anxiety, and it's important to focus on being open and honest about your experiences. We had come forward with these recommendations when we launched the playbook, but I think now more than ever, it's important for us to be normalizers in chief. We have to remind people that this is a global pandemic, that it's not an added opportunity for increased productivity. Remind your teams that not to expect normalcy during this time. A protracted global emergency is not normal. And I've been encouraging my team to lean in or lean out in whatever way feels best for them and their families. On a call recently, I had a team member apologize because their child was interrupting the meeting, not unlike mine is doing right now.
Oh, I love it. I love that. The humanity of my cats jump up in my lap or they walk across my keyboard. So then we get really strange emails.
They're keeping it fun right now. Okay. But I reminded that team member that not to apologize for their child interrupting the meeting. Really, whatever works for them should work for you as a leader right now. So as a normalizer in chief, we have to celebrate the good news and share your challenges. We have to remind our team members that they're doing great, especially when they feel like they're not. It's your vulnerability and courage that will inspire your employees to do the same and give you their best. So I would really encourage, and one of the questions that we would often get asked when we launched the playbook in these 5 recommendations, well, how much is it going to cost us as an organization to implement these recommendations? And, we would say, well, this study articulates the return on investment of an implementation of these recommendations, but it costs nothing to lead, right? It costs nothing to lean into your role as normalizer in chief and to establish a culture whereby your employees feel as though that they can adopt these workplace mental health resources and supports and systems that you've established to help them through this time.
That's really, really great. I don't know if you have anything to top that. And I think that normalizers in chief, and I think it costs nothing to lead, or just, not just during a pandemic. Obviously important messages now, but also just when we pre-COVID, they would have been great. I'm curious about, what do you think in terms of the need for mental health support? Obviously, it's going to continue, but will it be far greater? You talked about this eco kind of mental health, or echo, I guess it is, that it's going to kind of come back at some point. You don't know, and I think you're right. What do you think a year, 2, 3 down the road?
It's interesting. So before we, entered into this pandemic, we were already in the midst of a global mental health crisis. The stats spoke for themselves. 450 million people worldwide were struggling with their mental illness. 4,000, I'll give you a bit of a Canadian fact, 4,000 Canadians were dying by suicide every year. That's an average of 11 per day. 300 million people worldwide were affected by depression. 47 million people were living with dementia worldwide, and that number was projected to increase to 75 million by 2030. And then again in Canada, by the time a Canadian reaches the age of 40 years old, 1 in 2 of us have had or have a mental illness. So, the issue pre-pandemic was that we were in a global mental health crisis. That's why we as an organization knew that mental health is health. You cannot have health without having mental health. And I think this pandemic is just serving to exacerbate this crisis for all the reasons that we talked about before: loneliness leading to anxiety, burnout, depression, addiction, and a host of other mental illnesses. And that these risks are compounded by, financial instability, loss of employment, and worries over the health of loved ones. So I don't know what the future looks like. I do know that I think now more than ever, it's really important that we invest in our both physiological and psychological health, and really look to those research-informed mental health training tools, education programs, digital resources that we need to cope and build the resiliency to really just flatten the echo mental illness curve, I feel like.
That's very, very powerful. So Chris, we want to thank you for this terrific discussion. You represent your organization exceedingly well, even with 2 3.5-year-old twins probably barreling around the house. which
they were baking muffins, and I'm sure they wanted to give me one.
Ooh, are they already out of the oven?
I hope so.
Thank you so much for your time. And I also say that for all of our listeners around the globe, this isn't just about Canada. This is about the globe. And this is about that we, trust that these are really trying times, but we have some terrific insights here to work on our mental health as well as during social distancing, as we also take care of our physical health.